rules and regulations are also very helpful. I want to thank Dr. Fauci, who is really an extraordinary American and has given me great guidance and help and assistance in putting together these policies. So I'd like to thank him. And we're working on every level. Every piston is firing. Everything that can be done is being done. New Yorkers are lucky. We have a very experienced team that's doing this. This is not their first rodeo. They've been through a number of emergencies on a number of levels, increasing hospital capacity. We want to get the capacity of 50,000 up to a minimum of 75,000. We told the hospitals we're going to be ending elective surgeries. We are now working with hospitals to reconfigure the space in the hospital to get more beds and to find more staff to manage those beds. We're working on building new beds. We're going to go out and review a number of sites today. I'd like to get a final list to the federal government and the Army Corps of Engineers today. In terms of context perspective, don't listen to rumors. I mean, you have such wild rumors out there, and people call me with the craziest theories. I understand there's anxiety and stress, but let's remember some basic context and facts. Society functions. Everything works. There's going to be food in the grocery stores. There's no reason to buy 100 rolls of toilet paper. There really isn't. And by the way, where do you even put 100 rolls of toilet paper? The transportation system functions. The pharmacy system functions. These things are all going to work. Non-essential workers stay home, but the essential workers are staying home, especially the healthcare workers. There is not going to be any roadblock when you wake up in the morning that says you can't leave this place or you can't leave that place, right? So if you have a real question because you think there's a real concern from a credible source, contact my team. We have a special website, coronavirus.health.ny.gov, and ask the question, and you will get a real, truthful, factual response. I have not hidden anything from the people of this state. I have not tilted facts. Franklin Delano Roosevelt, the American people deserve the truth. They can handle the truth. Give them the truth. When they don't get the truth, and if you don't get the facts, that's when people should get anxious. If I think I'm being deceived, or there's something you're not telling me, or you're shading the truth, now I'm anxious. Everything I know, I've told you, and I will continue to tell you. And these are facts. And you hear a rumor and you want to check it out, go to that website. These are people who work for me directly, and you will have the truth. We do have an issue with younger people who are not complying. And I mentioned this before, but it has not gotten better. You know, you can have your own opinion. You cannot have your own facts, okay? You want to have an opinion? Have an opinion. But you can't have your own facts. Well, young people don't get this disease. You are wrong. That is not a fact. 18 to 49 years old are 54% of the cases in New York State. 54%. 18 to 49 years old. So you're not Superman and you're not Superwoman. You can get this virus. And you can transfer the virus. And you can wind up hurting someone who you love or hurting someone wholly inadvertently. Social distancing works, and you need social distancing everywhere. There's a significant amount of noncompliance, especially in New York City. especially in the parks. I'm going to go down there today. I want to see what the situation is myself. But it has to be stopped because you are endangering people. And if it's because of misinformation, if it's because of noncompliance, I don't care, frankly. This is a public health issue, and you cannot endanger other people's health. You shouldn't be endangering your own, but you certainly have no right to endanger someone else's. This is my personal opinion. This is not a fact. You know, to me it's very important that, especially in a situation like this, tell me the facts and then tell me your opinion. This is my opinion. We talk about social responsibility, especially young people talk about social responsibility, and they should. We pass a lot of legislation in this building, groundbreaking legislation, national firsts on economic rights, first highest minimum wage in the United States of America, human rights, first state to pass marriage equality, which I believe was a human rights issue. We talk about environmental responsibility. This state has the most aggressive environmental laws in the United States of America, and I am proud of it. But I also want people to think about the social responsibility when it comes to public health. We haven't talked about it before. It's not really a field. It's not really an issue. It's not really a hashtag. But social responsibility applies to public health just as it applies to human rights and economic rights and environmental rights. Public health, especially in a moment like this, is probably most critical. So let's think about that, and let's act on that. In this crisis, think of ourselves, we are all first responders. We are all first responders. Your